All right, well, good evening, everybody. Welcome to the June 22nd, 2023 open board meeting. We are now going to play the land acknowledgement. The traditional, ancestral, and contemporary lands of the Niswi, Ishkwiden, Anishinaabeg, the Three Fires Confederacy, Ojibwe, Odawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. Well, welcome everybody. This is strange. This is the first in-person board meeting in 3 years. So over 3 years actually. So welcome to everybody. It's great to see everybody's smiling faces. It's amazing. I didn't know what half these people looked like from the neck down. Pretty incredible. So thank you all for being here today. I'm going to call the meeting to order. Do we have any declarations of conflict of interest? Seeing none, thank you. Can I get a motion to approve their previous minutes? We have Mike, sorry. Paul, sorry, I was looking at Michael. We'll go first Paul, then Michael. Questions, comments, or concerns? All in favor? Thank you. Wow, this is so strange seeing actual hands, and one day I'll get used to this. So we're going to call up the President and CEO, David Mouche. David?
Thank you, Mr. Chair, and welcome everybody. I remember the last time I stood up here was in March of 2020, and I was talking with our staff and getting them prepared for what was about to happen to us here at Windsor Regional Hospital. And I recall, because at that time, from the time we became aware of the pandemic and what was going on across the world, and then what was starting to happen in Michigan and in New York and other jurisdictions in the United States, we were all prepared as a team, and we did our preparations and all of our pandemic planning. But pretty much the month of March, end of February into March, was probably our most nervous time during COVID. And the reason was we were nervous is we did not at that point have any COVID positive patients. So it literally was walking on eggshells, everybody, and you could feel the intensity because they were hearing stories from their colleagues over in the United States. And we had staff, of course, at that time that was still traveling back and forth and telling us, this is what's happening at the hospital in Detroit. This is what's showing up. This is what's happening in their emergency departments, patients coming in and unfortunately falling and dropping dead in the emergency waiting room with COVID. So it was pretty intense. And our staff was, again, ready, clearly, but it was just waiting to have our first COVID positive patient. So at the time, the talking with the staff was to say, we have to, this is what we did all our training for. This is what we prepared for. Going back to SARS, is we knew it was going to come. We knew this was coming. It was just a matter of when, and the when is now upon us. And now we have to put all that training together and help our community out and be leaders in our community, because they're looking at us and they're looking at what we're doing, and they're going to follow that lead. And sure enough, I gave an example. I remember at the time I had heard it, is Dr. Saad was in church back in like February of 2020, and people were behind him and in the pews, and they were deciding whether they would go up for communion. And they talked amongst themselves, and they said, we'll take his lead. If he goes up for communion, we'll go up for communion. So what I was trying to get across with that is, regardless of who you are, where you work in this organization, people in the community knew who they were, knew where they worked, and would follow their lead. And therefore, we have to lead by example. And sure enough, you go then through the next 3 and a bit years, and the staff did do that and led by example and did a phenomenal job taking care of our community and taking care of each other. So it is bittersweet to be here today. First time, like I said, since March of 2020, standing at this podium. But I remember that moment, and pretty much, I think it was like a couple days after that, we got our first patient COVID positive over at Olette, and Met followed shortly after, like a day later. And I remember us going to Olette, all of us, to go to see the staff to make sure they were okay. And we went up to the floor, and I jokingly said to Wasim, I'm going to go in and see how the patient's doing. Wasim's like, what are you doing? I said, no, I'm okay. Wasim, I'm not going to do that. So went and saw the staff, and they were good. They said, we got this. We're ready to go. And sure enough, they didn't stop from that date in March all the way through. Same thing here at Met. When first patient was here, they were like, we got this figured out. And they did. So here we are in 2023, over 3 years later. And so some of the positive stuff, and I won't take away from the AGM, but one of the things I wanted to focus on in the public report here is what we just announced is that our third MRI for Windsor Regional Hospital is up and running, and will be running full tilt in the next few days. So if you recall, back in December of 2022, the government had announced some 27 new MRIs for all of Ontario. And our previous second MRI in the region, we got like 10 or 15 years before that. So it was quite a gap between the second MRI and getting the third MRI. And our 2 MRIs are running 18 hours a day, 7 days a week, pumping out 22,000 MRIs a year. And I can tell you, other organizations from across the river have come over to try to figure out how we get so many patients through back when we had 1 MRI, let alone two MRIs, because they were amazed at the volume we could get through, even in the hours we were operating, with the efficiencies that the staff made. So now with the third MRI, we're going to get that number up to 33,000. So we're going to get another 11,000 MRIs done in our region. And I put the quote down, luck is what happens when preparation meets opportunity. So how we got lucky, and the fact that we have our third MRI up and running pretty much in May, it started May 25th, up and running in May when it was just announced in December, is what was happening is we were replacing the MRI here at the Met campus, and we got a portable trailer that's sitting at Olette while we were replacing the one at Met. So we were in the midst of replacing it. So what we were able to do is replace the one at Met. That's got up and running, and we have the trailer still. We were able to extend the lease. So that's the good luck that we had. So we're going to have all 3 up and running, and we are renovating space at the Olette campus. That by 2024, the permanent MRI will be at the Olette campus up and running. But in the meantime, we're still going to be running 3 MRIs in the region. So it's pretty positive to be able to have that happen. So what impact will that have is right now there's criteria with respect to priority patients is they have priority 2, priority 3, priority 4 patients. So when it comes to priority 2 patients, those are the most critical patients to get done. Is pretty much our wait time is 0. It happens immediately. The provincial's wait time is 3 days. For priority 3, which is more acute, the provincial wait time right now is 26 days. We average around 13 days. So we're underneath that. Where we needed help was with our priority 4 patients, which are the least acute patients. And those are the individuals, sore knees, shoulders, etc. We were running on average about 160 days wait, and the provincial average is 73. So that equates, we have about 5,400 patients on that wait list. So what this is going to allow us to do, if we're pumping out 11,000 extra patients, we should be able to get below the provincial average for sure in a very short period of time. So we'll not only be below provincial average for priority 2, 3, but also 4. At the same time, what's going to help out the region is in 2024, Erie Shores was approved for their first MRI, and they're going to be up and running. So by 2024, we're going to have doubled the MRIs in our region. Now, that doesn't mean that 4 is, the number we need years from now. So, we heard the government is announcing the Bill 60 with respect to external clinics being able to operate things like diagnostic imaging and doing surgery. So we haven't heard anything, but would expect access to MRIs to increase even in the community rather rapidly. But the one thing, if we can get the media to help us out too, is one of the issues we face is we have close to 1,300 patients that don't call and don't show up. So no call, no show up, and their time is vacant. So we're able to help a little bit by filling that time with inpatients and being able to bring inpatients down. But if people just give us a little bit of notice, and there's a number that's on the press release that's 7 days a week, and if you've ever had a diagnostic procedure, an MRI, you get those robocalls at your house asking you to please confirm, or if you're not going to come, because I know people get them because I get complaints about them because they don't like them. So, but they tell them, please confirm. If you can't, please tell us you can't, so we can find someone who's on this waiting list and get them in and take your spot. When people don't call and don't show up, we don't have time to call someone because the next patient's going to be on the table by the time we got someone in, no matter where they live, even if they live straight across the street. So as a result, we try to do inpatients when that happens and see what inpatients are available that still need an MRI to come down and do it, but still it's a big number. So all I would ask is that those out in YouTube land right now, if you know of someone who is not going to show up to their MRI appointment or any diagnostic appointment that's booked, just call. Just give us advance notice, 24 hours, beautiful. And we can fill that slot with someone else rather than having an empty spot, which just adds to the overall wait time. So on that note, that's my public report, but some very good news with respect to our MRI capacity in the city. So thank you, everybody. Any questions?
Any questions for David?
So whoever comes up here, if there happens to be a question, if you could just repeat the question and then answer it. Thanks.
Dr. Jacobs is not here, so his Schulich report is there for your information. Next up, we have the financial presentation with Ian McLeod.
Thank you, Mr. Chair. This feels really, really strange. And I've got an assistant. And she's not doing a very good job. According to that, I didn't say that directly. She said that. Oh. Thank you. As I were. And I have a feeling somebody has the clicker as well as I go through this. This is really great. Thanks, Melissa. Keeps me going where what I should be doing. Well, on a funding update, the hospital has received $6.9 million, almost $7 million in base funding. That's been included in the budget in the financial statements, and $113,000 in one-time funding. However, we have not received funding confirmation for the bed complements included in our budget year submission as follows: 8 critical care, 49 medical surgical, and 5 mental health. Next slide, please. Our financial results year to date show a deficit, excuse me, of $3.1 million from hospital operations, which is $2.8 million worse than budget. The net deficit after building amortization is $3.3 million, which is $2.7 million worse than the budget. This chart indicates expense variances and the offsetting revenue. Wages and salaries, we had budgeted reduced overtime, and that has not been realized year to date. Shows that the hospital is busy and people are actually working. Medical staff fees, offset slightly by a revenue from patient revenues of $653,000. Medical surgical supplies has a negative variance of $600,000, offset by a revenue variance of $300,000 for a net loss of $270,000. And on the drug side of the business, we're basically break even at about $147,000. Other supplies are $55,000 in the positive. It's an early start. This is only the second month. This is the month ending May, so this is the second month into the year. I would take any questions, Mr. Chair. Seeing none, the next thing I believe is a motion to accept my report. I believe that's it. And Melissa's back, so I must be having to sit down.
Pardon me, just so everybody knows, the correspondence, printed matter, and media report is in tab E of your package. That's for your information. Any board member questions, comments, notices of motion? Seeing none, thank you. The date of our next regularly scheduled board meeting will be September the 7th here at the Met Auditorium. Can I get a motion to adjourn? We have Genevieve, seconded by Laura. Questions, comments, all in favor? Perfect, thanks everybody. So we'll give David 5 minutes or 10 minutes, and then we'll come back if there's any questions from the media. Thanks.